Good morning, good afternoon. Let me start by stating that we probably all agree that the current situation is simply not acceptable. Let me cite three figures. First, according to UNICEF's State of the World's Children Report 2019, malnutrition worldwide costs the economy no less than 3.5 trillion US dollars per year. In the United States alone, where 20% of children live in poverty, the impacts in terms of higher crime rates, ill health, or lower earnings in adult life, the impacts of child poverty linked to malnutrition are estimated to amount to 1.1 trillion US dollars per year. And if we focus on the problem of stunting in high burden countries, it is estimated that each dollar invested to combat child stunting will result in economic returns equivalent to 18 US dollars. So malnutrition is extraordinarily costly. Investing to combat child poverty to reduce rates of malnutrition is a hugely important investment to make with very high economic returns. Yet, not all countries, far from that, have until now adopted social protection floors that protect all individuals, women, men, and children, from the risks of unemployment, in health, disability, or old age. Social protection floors are still not universal, and I think there are two stumbling blocks, two obstacles to the full implementation of the commitments made with respect to the universalization of social protection floors. One, very simply, is the financing gap. It is estimated that for low-income countries, even after the COVID-19 crisis, the financing gap is equivalent to some 80 billion US dollars. Now, that is the sum that these countries would need to be able to mobilize in order to make up for the difference between the investments they've made until now in social protection and what it would cost to cover the whole population with robust, standing, rights-based social protection floors. $80 billion may seem lots of money, but it in fact is a very small amount in comparison to the possibilities that rich countries have to support social protection in low-income countries. $80 billion is less than a half of the total official development assistance provided by OECD countries to low-income countries, and it is a fraction of the total wealth that is produced in OECD countries. So we can help, and rich countries can do more to support the establishment of social protection floors in developing countries. The second obstacle is that in many poor countries, particularly small countries, the economy is poorly diversified, and these countries may fear that they will be subject to certain shocks, economic shocks, a loss of export revenues, an increase of import bills, climatic shocks, or indeed epidemics, such as the one we've seen with COVID-19, and that as a result of such shocks, they will not be able to finance the social protection schemes that they have established for their population. They may face funding shortfalls in times of crisis because at the same time that the needs increase within the population, the revenues may fall and countries may, as a result, face liquidity problems. So we need to provide these countries with an insurance against that kind of risk. We need to commit in advance to supporting financially these countries so that they indeed invest in standing rights-based social protection floors for their population, encouraging them to make this commitment that each individual shall be covered with basic income security throughout his or her life. This is why, together with others, I have proposed the establishment of a new international financing mechanism, the Global Fund for Social Protection, that would be not only a platform to coordinate action in support of the establishment of social protection floors, but also a means to make up for the financing gap encountered by low-income countries, and a tool to provide a reinsurance mechanism to protect countries with a poorly diversified economy from the economic, climatic, or pandemic shocks that they may experience. I very much hope that this shall be the next step towards the establishment of universal social protection floors, as all governments unanimously, together with social partners, have committed to do when they adopted Recommendation 202 on social protection floors within the International Labour Organization in 2012. I wish you an excellent discussion and look forward to discussing this proposal with you.